So what does the OP program, the Skype treatment process look like? You've already started. Some of the videos you've already started to watch, providing you with information about how the body works and how your pelvis moves that you're going to be applying and using to better understand how to perform rehab exercises and how to fix your OP. But it really starts with that first 20-minute session you're about to do. Here, I'm going to take that video, the video test that you did, and I'm going to analyze it with you frame by frame. I'm going to show you where your pelvis is making its mistakes, what you're doing that is overloading your pubic bone and causing you the pain and discomfort you're experiencing. And I think this is really important so that you can get a real kinesthetic and visual sense of exactly what it is that your injury is. And a lot of people, they know OP is this idea or this concept or this inflammation on the pubic bone. But it's another thing to visually see it and kinesthetically understand it and feel it in your body. And my hope is that by going through this assessment frame by frame, you can see it and you can go, I can see why I'm hurting myself here. So therefore, I know what I need to start fixing in order to get better. And what I'll do after doing the assessment is I'll take you through what a healthy, normal body would be doing so that you can have an understanding of what you're training for and what the end product should be so that you don't have pain when you're moving. After the 20-minute assessment, if you decide to go ahead with the program, you'll book in for a first full consult, and from there, I will send you a spreadsheet with a bucket load of videos for you to start watching, similar to some of the ones you've watched just in preparing for this 20-minute session. Amongst those videos will be concepts and ideas like mountain pose, like spinal length, things that you need to apply to correct some of the baseline issues that occur in your body. And then there'll be some exercises where you apply those concepts and ideas to movement, like working on your body squat, like working on a lying pelvic tilt hold, which is a specific core exercise I like to use that integrates core breathing and a few other things that are specific to OP that most OP patients are weak in. And then what you'll do is record those videos and send them to me. And I'll then send you notes back, basically things you need to improve, things you need to work on, so that by the time we actually go in for our first full session, you already understand and know what we're going to be working on. You've already started practicing some of the exercises, and you've already got a complete running start into this issue. So when we jump into that session, we'll work on the specific stuff that you either A, is too complex or too difficult to do on your own through a video and needs kind of an interactive one-on-one process that we can do through Skype, or you're just not getting, you're not understanding, that's just not getting through to your body, that you just can't get right, that you need me there to walk you and talk you through so that you can get it right. And that way you're getting the most out of your time and you're getting better as fast as possible because you're doing as much as you can on your own. After that session, you'll then send me more videos of you performing some of the exercises you were working on before, some new exercises we would have gone through. I'll send you notes back again, telling you on improvements you need to make. We'll do that twice, so you'll send me 2 sets of videos. I'll send you 2 sets of reviews in order to correct those mistakes in the videos. Along that process, you'll be watching new videos for the new exercises that we're going to be covering. And in that way, you will continue to work through the functional hierarchy so that you're continuing to make progress and you're moving closer and closer to building the strength and the movement patterns that you need to perform the actions that you want in your real life. And then we'll just keep following that process and you'll just work through stage after stage, getting stronger and stronger until you're better. And it's no more complex than that. You have OP because you move badly, and you need to assume that every movement you're making every day is probably putting some degree of pressure on your pubic bone that it doesn't want. And all that this recovery process involves is learning and understanding what you're doing wrong, learning and understanding the really core principles that you need to be applying in order to correct those mistakes, and then being able to apply those core principles in more and more complex situations, starting from something as simple as standing to eventually being able to apply them when you're sprinting and when you're running, so that there isn't a movement that you perform in your life that you don't perform correctly and in a way that supports your pelvis rather than overloading it, which is what it's doing now.